Hi everyone and happy Friday. We are back today with Ultrasound Unplugged. I'm Destiny. I'm going to be your host today, and we're going to be starting a new series actually. It's going to be about a topic that we are involved in quite a bit and we see a lot of patients for. It's going to be about IVF. And if you don't know what that stands for, it's going to be In Vitro Fertilization. And over the next few weeks, we're going to talk about the processes that we are involved in. So this is really going to be more about the ultrasound side of things. But we're also going to talk about challenges that we see, stories that we've heard from patients as well. And hopefully we're actually going to have some techs be able to come in and speak on this too, since they probably have a different perspective than we can give. But for today, to guide us through our conversation, we're going to have Christopher here with me. And he's going to be kind of guiding us through my questions. So thank you for joining me today.
Thank you, Destiny. I appreciate that. I'm really excited to dive into IVF, or IVF monitoring as we like to call it here, because it's such an important subject about science and the emotion of it. It's not just about the medicine specifically. It's more about creating families, about supporting those that are involved in the personal journey.
Yeah, it's becoming a pretty big thing, I feel like. So why don't we just go ahead and start with basics, right? So what exactly is IVF and why do you think it's becoming more common?
IVF or IVF monitoring stands for In Vitro Fertilization, as you said earlier. It's a process where an egg is fertilized with sperm outside the body in a lab and then transferred to the uterus. So this all takes place not here at our company, at another facility. It's used for couples struggling with fertility, same-sex couples, and even individuals who want to pursue parenthood. Advances in technology and greater awareness have made it more accessible than ever, and especially at facilities like ours where IVF monitoring has become more prevalent.
Yeah, and I mean, that makes sense, especially with, I feel like how diverse relationships are in our world now too. But so when we talk about IVF, we talked about how it's not really just about medicine. It's not just a medical procedure, right? It's an emotional journey. Would you agree?
Yeah, of course. Absolutely. There are physical steps like hormone treatments that we don't do here, the egg retrieval that we do not do at our facilities, the embryo transfers that we don't do here. But alongside of that, the IVF monitoring, we do those here. It does come with some hope, some anxiety, and sometimes some disappointment. We want to highlight the balances in the series, helping listeners to understand both the science and the human side. We really want to dive into the human side because when it comes to the monitoring, we see and hear the ups and downs of these patients with their families or significant others coming in, and it really impacts us, and we can see that it impacts them as well.
Yeah, and we've actually, I feel like our techs especially have formed relationships even with the people that are going through it. I mean, so whenever you're doing IVF monitoring ultrasounds, it's usually there's multiple of them within maybe like a week or two's time. And so our patients that do come in for those, we know their names pretty much. Just if you call, you say your name, we'll recognize you. Our reception knows them. So I feel like it's... in our offices specifically, we've done really good, in my opinion, at forming those bonds and getting to know those people rather than just like seeing it as, okay, you're getting your service and then you can go, if that makes sense.
I think a lot of the times patients, a normal patient that's just going to their PCP, they're going maybe once a year, twice a year, maybe 3 times or 4 times a year. We're seeing some of these IVF monitoring patients 10, 15, 20, 30, 40 times.
Yeah.
So they're not just here one time and then they're gone. They're here a lot of times. And so you really do get a chance to really get to know them and really get to hear some of the struggles, some of the successes. And so it's enlightening, very much so.
And something that we also see a lot, once you get to know people, you get to know their situation, maybe their stories. We even get to know their schedules in reality. Like, we know what times they need more than others. But another, I think, big part is the financial side of this, because a long time ago, I think it was a lot harder to get involved in IVF treatments. And especially... we do the ultrasounds, like we mentioned, but that can still, the financial side of that can still be pretty overwhelming. So what should people know when it comes to insurance and billing when they come to us for their ultrasounds?
Well, they can first call us with their insurance information because, believe it or not, IVF itself can be costly. We are trying and consistently attempting to get in with new networks to find providers, insurance carriers that actually help with this. A lot of the insurances that we currently take do cover your IVF monitoring, and so you want to make those calls and see if your insurance covers the exams before you get here, being proactive and asking those questions before you come to our office so we can have all of that lined out for you. That way, when you do get here, there's less stress, there's more knowledge, so you know what you're walking into rather than, being blindsided by possibly having to come up with more money. In many instances, your insurance plans will cover it. We just need to make sure we check your insurance benefits, check against that specific diagnostic ultrasound that you're having done, and usually they do cover them. There's a big misconception out there that it's not covered. I think a lot of the insurance companies have changed their stance on it being covered. So at Ultrasound Services, we try to work as close as we can with the patients and get them the explanations and the insight they need prior to them coming here. So we know, everybody knows how stressful bills can be, whether it's IVF, whether it's a broken arm, whether it's something to do with your heart. Bills tend to pile up pretty quickly. Very, very quickly. So we do have other options for IVF. We have IVF monitoring packages. These are discounted packages that allow for IVF monitoring to be a little more cost effective. We also have financing available for those packages. Afterpay, Affirm, I apologize.
We have Patient Buy, and then we have Lending Club, right?
Yes, ma'am. So you've got those options. These are options that we can discuss on the phone before you ever come to our office, assuming you need that type of help.
Yeah, and it's always good for the patients to be proactive, like you said, but also personally, when I've had insurance in the past, it is kind of hard maybe to understand what they're saying or to kind of work with them, and so I know, this is more my side of the job, I guess you could say. But, if anyone ever calls and they're not sure if it covers or, they're struggling to get their insurance to figure it out with them, I work closely with insurance companies as well. And I try to, talk to someone on the phone at least or look up their benefits. And we really try to find a way to make the insurance work. But I know that a lot of people, even who maybe don't have insurance for this specifically, our prices are pretty affordable in comparison to competitors, even if you were just paying out of pocket. And like he said, we do the payment plans too, which is really helpful. I know a lot of people have used those as well, and even Care Credit. You can use Care Credit.
Yes, you can use Care Credit here. You can have, literally, you can have these paid for before you come to our office without us even.
Yeah, and something that's cool about our bundles also is that, a lot of people ask, well, if, everything works out and I don't actually need all of the ultrasounds that come in the bundle, then you actually get that money back. Not back, but you get that money used like a form of a credit that you can use for a fun exam or for exams that you need once you are successful and you are pregnant, which I think is really cool to offer as well.
Assuming the pregnancy is successful, they would need follow-up exams, and they could use that prepaid amount for those follow-up exams. We've had many patients do that, and it seems to be very beneficial because they're still getting a discounted rate, which obviously, I love discounts, I'm not going to lie. I try to buy everything I can with a discount. So it's very beneficial, and it helps, again, to alleviate some of the challenge of the cost.
And the hassle, I would say. Our patients that we see pretty consistently and we know their names and, the calls that they make to schedule their appointments, less than 5 minutes. It will take you a 3-minute phone call and we'll schedule it. And all you have to say is your name, you're here for IVF, and we can see like that you have a bundle, and we'll just say, okay, you're all set for that day, which I think is, I mean, I can't imagine how many other appointments they're probably having.
Right.
So we really try to make the ultrasound part of it as simple as possible. And so families who are considering doing IVF with us, if you ever have any questions, you can, like I said, we don't do the treatments, we do the ultrasounds. So if you're already doing IVF treatment or you're looking for it and you want to maybe see how you can alleviate some of that pressure on the ultrasound side of it and you want to talk to us, we always have people here able to talk to you about that, including me. But when we talk about the series, I wanted to ask you why you think it's important to even have a series about IVF.
Well, IVF is, as we know, it's becoming more and more accessible. That accessibility means we're going to start seeing more and more patients. We need them to be informed. We need their families that are coming in with them to be informed. We want them to be able to be involved in the process that is honest, that is informative, that is clear. We don't want them to leave with more questions.
Yeah.
And so we want clarity. And so by breaking it down episode by episode, we can guide both IVF patients as well as anybody that's involved with them in that process through each stage. The preparation, the treatment, even after they've conceived, the next steps. Sometimes we are involved in those steps, and we want them to be able to have comfort and understanding of that process.
Yeah, I think we just really want to educate people on this, and like, because it's becoming bigger, like we were saying, we just thought a series would be really cool to answer some of those questions. And I know the techs really like sharing stories from some of the people that, that have shared stories with them and are okay with maybe talking about it. So I think that would be really interesting. And maybe it could be encouraging to some of you out there, if you're listening, if you need some sort of push or, some sort of extra motivation, maybe this series could be that for you.
For me, I think when I think about this, I think about the first walk that we did. That walk, you don't really get a sense unless you're talking directly to the patients. And that resilience, that support, that to be able to be there and hear those things and actually give support to those things.
Yeah.
And listening to these patients when they come in and their stories and their journeys, it's very inspiring. And we just want to continue to build on that. Build on whether it's successful or not, we're here to support that process.
Yeah, and I think it's important for us to be a part of that community as well, and to just show that, we have 5 locations that you could pick from. So, we're all around Houston, and so I think it's really helpful to be involved in that community within the city in general, even though we get people from all over the place for that. But so
we are also involved with Positive IVF. They're a local fertility place. They actually have less expensive plans for those that are seeking IVF. And so, engaging in the community, engaging with those around us, providers around us that need our help to get this monitoring done. It helps us to kind of strengthen the community, strengthen the processes, and help those that are going through that make it a little easier, a little more transparent, a little clearer.
Yeah, and hopefully with the series we can even maybe try to have them on one of the episodes, and we can maybe even give more educational insight into the actual treatment side of it, which I think would be really helpful.
And I think that's where we're going with this. We've already reached out to a couple of IVF places who actually go through from the beginning, and so we will eventually introduce them and have this podcast hosted at one of their facilities, bringing us together. So that again is going to be just another piece or another episode within this process.
Yeah, and I think this was a great introduction to the series. But listeners, if this is just the beginning for you, or maybe you're not even doing IVF or you're interested in it, I would check back in next week, and over the next couple of weeks we'll be uploading new episodes on our Spotify. And then if you are just interested in maybe learning a little bit more about what we do, our website is a really good place to go look for that, which is just ultrasound-services.com. And so we are excited to dive deeper into this, and thank you, Christopher, for helping us kick off the series.
Thank you, Destiny. And yes, our website does have some good information. We also have Fertility First Step. If you are considering IVF, this could be a starting point for you. IVF monitoring packages are there. You're more than happy to investigate, look and see if those work for you in your process. We're super excited, as she said, to start this series and possibly introduce other companies into this series as well. Thank you too for your time.
Yeah, of course. And we wish you all a wonderful weekend. And like we said, go ahead and check back in next week on Friday for our new episode.
Thank you.
Bye-bye.